So you at least have gloves on as minimal, right? Okay, so go ahead and start your assessment. You gotta teach these kids. They'll do whatever you tell them, and you got some toys, and they kind of left some toys here, maybe, but you got toys over there. Okay. Alrighty, so this gentleman's laying on the bed, and you can just hear some agonal respers just.
Sir, are you okay? No pulse. Call.
Oh, he has a pulse,
Oh,
so
he has a
you
pulse.
didn't wait long enough. How long you gonna do that?
It took less than 10 seconds.
I know, but she was like
For less
2.
than a minute.
So his pulse is at 30. Agonal.
So we're gonna ventilate him.
And how often are you gonna give him a breath?
Every 5 to 6 seconds.
Okay. And what else do you want your other peeps to be doing? You got a pulse of 30. He's got agonal respirations. You're giving him ventilations, 1 breath every 5 seconds right now. What other vitals do we need?
Blood pressure.
Oh, maybe a blood pressure. Yeah, well, that's probably 80 over 40.
Somebody better get an AED.
Okay, put an AED on him just in case. Okay, so you could do that. He's got a pulse though. Now with your ventilations and stuff there, if he had agonal respirations, what would
He's
you?
gonna be hooked up to oxygen.
Yeah, and this mask too doesn't work. But what could you be thinking of? What's the leading cause of agonal respirations? Choking could be his tongue. Oh, as EMTs, what could you put down there? An airway. I think there's some over there. She had one on the bed, maybe, but maybe not. I guess they put it over there. There we go. Measure it from mouth to ear. There you go. Good job. He's really going to get that off. He doesn't need that. Okay. So you would do that. How long are we going to do this? Or are we going to? When are we going to think about transporting?
We're gonna do that right away.
Okay.
We're gonna get the cot, we're gonna get everything ready and get ready for him to load.
Okay. And as you're moving them over, do we always reassess once we move them?
Right.
Okay. So you do, and you're not hearing these agonal respers anymore because she's bagging them. What's somebody else want to do? What do you check? You got A, B, circulation. We're gonna check his pulse.
Check your pulse.
Okay. He doesn't have one anymore.
Starts compressions.
Okay. What's our rate of compressions? Low and back. So that's another one down.
30 compressions and then 2 breaths.
Right. And being, if you like the song Staying Alive by the Bee Gees, don't sing another one bites the dust out loud. If you like the song Baby Shark, though, that is actually 120 beats per minute. But your partners will probably kill you, so if you want to keep them handy.
We're gonna get the AED on and all.
What else could you think about putting on him? She's doing compressions. What does your other partner?
Oh,
Look up the Lucas.
Lucas, he doesn't complain or anything. He works really hard, doesn't he?
He does.
Yeah, put Lucas on him. Does that free up your hands?
Mhm.
Yeah, and start transport, right? Okay, so yeah. So now, all of a sudden, how often should you check to see if he has a pulse?
after cycle 3 or the AED.
Could you check it every few minutes?
Mhm.
Okay, so you put Lucas on pause. You're gonna check for a pulse. Where are you gonna check for a pulse? Yeah, I'd probably check carotid. Okay, don't do them both at the same time though, because then he will go into cardiac arrest. when he comes back. Yeah, you can feel a pulse on this student. So if you've never felt one, we'll have you guys try it. Okay, but yeah, so check a pulse. He does have a pulse now.
Mhm.
Okay, his pulse is at 60. Okay, now what do you want to check? Because you remember you did your ABCs, they come back in reverse order, CBA. So he's got the motor going. Is he breathing on his own?
BP.
Obviously, he's still unresponsive though because he doesn't have a gag reflex because he's still up there.
Exactly, because he's not breathing yet.
Okay.
Okay, is gonna come back, and it takes a while for the breasts to come back, and it takes even longer for them to come back on a regular basis. Not too many people wake up and say, what the heck happened? Okay? It takes a while, but you're right. So then as he's starting to wake up now, look at those eyeballs open and blinking. He's starting to wake up. What if he starts tonguing that? All right, take it out. Do people vomit easily? Yes. What else do you need ready? Suction. Look at that. You saved them. Piece of cake.
I had a person looking at me really once when they were in.
It's right. Yeah. If they have an old gag reflux.
Yeah.
Yeah, I worked with some partners. They didn't have one. Remember the old EGTAs that we used to put way down, the gastric ones? He could swallow one of those. We just leave them on the couch with it. Okay. I know this BDM is pretty flat and his chest really doesn't rise with it. But one thing I do notice, and I correct people when they come up and test for CPR or ACLS or anything, is a lot of people don't know how to use a BDM properly. Okay. Some of them will say, well, I'll just do the compressions or I'll just do the bagging because my fingers are small and I can't get a good seal. That's BS. Okay. Grab the hub, press down, grab the chin. You got to have that head back, and you may have to actually move it. He's so rigid though. Have it there. You have this, a seal. The bag is weighted. Keep the bag down and then give them a breath. Just nice, over that 1 second. Give them a nice breath on there. But the bag is weighted. What I see too many people doing is going like this or up here or back here. That's not going to get them a good seal. If you have a good seal, you're going to realize it's not going to take much air to get that chest to rise. So really practice your BBLs, okay? Because if you can get a good seal, you got it. Now, it's not American Heart Guidelines or anything, but I cheat because you got to figure out what works for you sometimes in the situation you're at. Now, the class before that, his head was way up here. This here pops off. One, if you're in a hospital or they have a hospital bed, this will pop off. This you can put underneath them for your compressions. Because when you're doing compressions on this, didn't it sink down? Now you have a backboard. Okay. So you can slide that underneath them. Move the body to wherever you need it. Okay. To get a good seal with the BBM on there. Because that's important. Why cheat? Because I worked in the helicopter too long. You can't go to the head. Right? So, unorthodox, I would be here doing compressions. I could reach up here, do a V, grab the bony part of the chin, tilt his head back. I have a seal on my left. Let this way down. I now have a seal over here. And I could go right back here in less than 10 seconds. Is it in the textbook? No. Do you sometimes have to think outside the box? Yes.
You never know where they fall in either. They're in a corner or whatever else. And
right. You may
you don't
not
want
be able to get
drag
there.
them and-
Right. So can you think outside the box and figure out a way to get a good seal? So practice different ways when you get into those situations. Does it have to be textbook? As long as it works, it's good. Okay. Now with this person now, we've got another call. He calls in. He is feeling heart palpitations. So heart palpitations is when the heart rate is just racing and you can just feel it just pounding in his chest. Okay. So what are we going to do to treat him? Do we have to do anything?
Or we're gonna lay him down if he's not laying down.
Okay, and sometimes it might be hard to lay down and breathe. If he's comfortable sitting up, could we leave him up sitting up in that semi-followers? Yes.
Yeah.
So you're gonna check his pulse, right?
ABC is what was said online.
So you got he's talking to and he said my heart is just pounding. Okay, so heart rate is 200. Normal? No, it's really trucking along, isn't it? Okay, what else you gonna check?
Medication.
Medications, I don't take anything. I don't go to a doctor, nothing's broken. Okay, what's another vital that you need?
BP.
Blood pressure. His blood pressure is up there 220 over 110. So heart rate's up, blood pressure's up.
Has he eaten anything today?
Yeah, I had breakfast, bacon and eggs.
What's his blood sugar?
I don't know.
Glucose level?
We'll say it's normal. He just all of a sudden his heart took off racing, right? Causing his blood pressure maybe to go up, or maybe he has hypertension. He doesn't go to the doctor.
Give oxygen?
Could you give him oxygen? Yeah. So when do we know to give oxygen?
Check his O2 stat.
Okay, and his O2 sat is at 96. Does he need it? Okay, what if it was at 90? What would you give him?
2 to 6.
Yeah, 2 to 4. You get him up to be somewhere between that 94 to 99%, right? Okay. What if he says that, you know, even with this oxygen on and he's at 98%, but I can't catch my breath. It's just hard to breathe. Do you say you're just doing fine? Or can you give them a non-rebreather for fun? Yeah, if anybody says they still can't breathe and that's not adequate enough, put them on a non-rebreather. Is it going to hurt them? No, we used to put everybody on them, right? 100% all the time. But yeah, if they are hungry for air, don't withhold it just because your machine says, well, you're good. Okay. You might calm them. Okay. So now, do you need ALS for this? He's got a high blood pressure. He's got high heart rate. But otherwise, he's conscious and talking to us. He looks good.
He is now.
He could have a stroke. His heart could tire. Okay. So you got ALS, but you know, it's going to take a while because of all the weather and all. But what can you do to slow down his heart rate as BLS?
Is he breathing fast?
No, he's breathing normal. But you're kind of on the right track.
Have him bear down.
Have him bear down. Because think about yourself. You have that 9 a.m. poopy every day. And it's 9:05. You're late. You're bearing down. What do? You hold your breath, right? Okay. When you hold your breath, slow down the heart rate. Yeah, it causes a vagal response. So could you have him pretend to have a poopy? If he does, somebody else will clean it up. You tell him, then your partner cleans it up. Okay? You could do that. Another thing that you could do is have him cough. Try coughing, because that too will do it. Try to bear down. Try to hold your breath. Other things you could try to do, take one of those vinyl gloves and try to blow it up and make a puppet out of that baby. You know, you're going against resistance. They say even a straw, you just put your finger over the end, have them try to blow. If you have a syringe, have them see if they can blow into the end and see if they can pop that plunger. You're getting resistance, right? What are they kind of doing? They're blowing really hard. They're kind of bearing down. Those type of things. Can that slow their heart rate down? Absolutely. Maybe when that heart rate slows down, the blood pressure will slow down. Come down too. Yeah. So you guys might fix them before ALS gets there. Make sense? Yeah. So something to think about on how you could do that if the heart rate is going really fast. Okay. With some of those cardiacs, what if they just come in with the chest pain? Heart rate is normal. We're in the 80s. Having crushing chest pain.
What's the blood pressure?
Blood pressure is doing okay. 140 systolic. The pulse is at 60.
And what's the oxygen?
Oxygen is at, we'll say, 92.
I'll probably give him just some oxygen just to make him feel a little bit better.
A little bit better.
That chest too.
Okay.
Are we doing aspirin and that or?
You can, if your protocol calls for it. Yep, give them the aspirin if there's no contraindications for them.
Listen to airway.
Pardon?
Listen to airway.
Listen to the airway. Yep, listen to those lung sounds. Listen to the heart tones. What's their skin color? What do they feel like?
Are they clammy?
Yeah. Yeah, what's their color? You know, they might be just diaphoretic, you know, just pouring that sweat out and it's -20 outside. Normal? No. So thinking too, you know, what's going on with him? Okay. What if he said that, yeah, I have this chest pain. It's here. and he's had this cough going on. So he's got this cold allergy type stuff going on. He's coughing, but he feels this pressure in his chest. Is it going to make a difference to what we do? No. Put your eye goggles on.
Is he feeling any pain anywhere else?
No. Just across that chest.
Action for comfort, additional comfort and transport.
So what if that pressure on his chest, you know, when you tell him to take a deep breath,
Or does
causes,
it need radiating pain
it doesn't radiate,
or a sharp pain?
it's a sharp pain. What's that telling you?
How about a pulmonary
Could be a
embolism?
stroke.
Could be a PE. How are you going to know if you have a PE?
Well, they usually have the sharp pain when you ask them to take a deep breath.
Could. And also, could they maybe have diminished lung sounds? Possibly. Yeah, but when they tell me, if I say take a deep
If
breath,
they've had any surgery procedures in the last 2 weeks, like knee replacement, hip replacement.
then you don't give them the aspirin.
Right.
They're gonna bleed. But yeah, usually if somebody tells me I have sharp pain when I take a deep breath, in the back of my brain, I'm like, it's not cardiac. It's lung. Probably pneumonia, pleurisy, things like that. It's not the heart, it's lung. Okay, we'll do fine. But if they have that dull, crushing pain, like it's something sitting on their chest, heaviness on their chest, that is telling me it's probably cardiac versus that sharp pain with each breath. Okay, you know, is it consistent? Does it come and go? Like you said, does it radiate? What does it feel like? Is it sharp? Is it dull? Is it constant? Well, it's sharp every time I take a deep breath. Okay, so really listen to your lung sounds. We just listen here, 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 and here. You can listen to the back, get all fields. Because remember, there's 3 lobes over here, 2 lobes over here. Don't miss your lobes. Okay, so listen really good with your lung sounds. You know, what do they sound like? Going through, because that could be pneumonia. We're hearing a lot of people with bronchitis right now. Pneumonia is going on. COVID is an obvious one. You know, but yeah, RSV is huge with adults this year, especially this last summer. Okay, so really listen to those lung sounds. Do they sound the same? Always compare side to side. Are they diminished at the bases? What do you hear? Just say it like you hear it, you know, like it sounds like a fish tank. It sounds like, you know, going on in there. So being able to do those type of things. Make sense on that cardiac aspect of it? Piece of cake. See, look at you already saved a dead one. You saved a fast one. You saved a slow one. We're early. And you got your BBM. But if you've never felt a pulse, you can usually find one on him. I know you have a. Yeah, you can feel. I don't know if you can feel it on both sides.
Right there.
You got one on that side?
You have to kind of push it out.
Probably can't do it at the same time. But see, if you've never done it, see if you can feel his pulse going through. But don't forget, you know, you can always have your Lucas off. So when you're doing compressions on somebody, you're doing that 2 breaths to 30 compressions. When should we switch compressors? If you're doing CPR and you have somebody's doing 30 compressions to 2 breaths, how often do we switch a compressor?
After one cycle, usually 2 to 3 minutes.
Yep, within 2. But if they say, "Oh, I'm doing okay,"
After 3 rounds?
there's no choice, right? Make sure you do switch every 2 minutes in the middle of it. Yeah. And that's where Lucas comes into play, especially when you're short-staffed. Okay. Can you feel his pulses?
It's a lot easier on the human.
Maybe he is dead.
He
wasn't working
before. Underneath the jaw, kind of
I had a pulse down here earlier. Oh, there it is, right there.
That was high.
It's not, it's kind of in that area.
His fingers even
Yeah.
moving.
Yeah, use as many of your fingers when you're looking for pulses, just because of, you know, don't, one finger you might not get enough space. So use as many fingers as you can. Yeah, just don't break their teeth because then you have to buy them. If they have dentures, sometimes you can pull the dentures out, just don't lose them.
It's easier on a human than it is
Yeah,
bloody or.
right. And I even find if you, instead of doing that 90-degree turn, if you have a tongue blade,
Oh, yeah.
you just go straight in.
Mhm.
Just press down on the back of the tongue with the tongue. Like one, that's gonna check your gag reflex. And then two, you can just slip in the oral pharyngeal real easily. Nasal pharyngeals you can use too, you can consider those. Most often they're designed for the right nair, simply because most people in the US are right-handed. So it goes down most often in the right nair, too, because most people in the US are right-handed. That's the side they pick most often. So that nair is already pre-calcified in there and it doesn't bleed as easy and it's larger. And it goes down slicker than snot. Can you find it? He's kind of a tough one. But you know, practice on as many people as you can so you get comfortable. So with that way, if you know what normal feels like, when you go to find something else and it's like that's abnormal, that's gonna ring your bells. Versus like, oh crap, what do I do? You know? So again, that like they talked about, you know, just that they push in and up. That's supposed to help a little bit on this guy. But normally in a real person, you're not gonna push that hard because you're gonna close it off. And never do both sides at the same time. That's called choking. And you will kill them.
Definitely one of the newsrooms in the other.
That's why we're staying here.
You feel it moving around, but
He
There
have
it
never
is.
been on a cardiac arrest.
Well, I think I did CPR on a dead guy a long time ago, but.
Okay. But everybody's been on a call with a cardiac arrest.
My first call was cardiac arrest,
Was it?
and she was DOA at the hospital.
Okay. So what was your scenario?
Well, I was in EMR at the time.
Uh-huh.
The husband called, said he had been performing, she had gotten up from supper and was walking to the kitchen and collapsed. And husband said he was doing CPR. We don't know if it was effective CPR.
Right.
And he just got tired and called us. So, the doctor came to the house. We had the Lucas on her. And the Lucas was maybe a little too low right away because she was regurgitating on the way to the ambulance.
Yeah. Dead people can puke
Mhm.
no matter what, and depending how
I
much
was
air
on,
you put in there.
I was on ventilations. It was,
And it's hard.
Mhm.
And it, with ventilations and somebody doing compressions and you're in that stressful moment, you really have to watch that ventilator because next thing you know, that ventilator, especially if it's a kiddo, they're bagging at the rate of the compressor.
Mhm.
Okay. Be very careful of that. So you're not over ventilating and you're only doing enough to watch that chest rise. So really watch it. Cause I've seen too many people, you know, where they're bagging and they're looking away or they're looking at the monitors. They're not looking at what they're doing. You know, was that effective? Yes or no?
Our actual sheriff was there too and watching the ventilations for
Good.
me too. So.
Good. And how do you know that Lucas or your partner is doing effective compression? What do you look for there? How can you tell that they're doing effective compression?
Chest recoil.
Okay, so they're getting it up, but
Yeah.
what's a good way to know if they're making the compressions or perfusing?
Skin color?
Skin color might change,
Chest
Have the
rise?
EEG on, it'll show it on the monitor and it spikes.
might spike, but what can you check just on your patient?
Chest rise?
No.
No? Yeah.
How about a pulse?
Oh,
I always loved it, somebody's doing compressions and you get somebody down here. I got a pulse.
you can feel it.
Oh,
too.
lost it. Got a pulse. Lost it. You know, you should that's what you're trying to do. You're only doing about 30% of what the body would normally do, but you should be doing it enough to create a pulse. That's your goal. Get that blood going round and round. Because really, are we preserving this? No, we're preserving this. Okay, we're trying to preserve that brain. Because for every minute that they're going down, where that blood's not going around and around, you're losing about 10% of their cognitive. Now they might not have used that 10% anyway, so we keep trying, right? Okay, but you want to keep that blood going round and round, and that's kind of the purpose of the hypothermia too. It's not so much for the heart, but after cardiac arrest, do they have some brain swelling? Yeah. So we're preventing that. We're preserving the brain. Or even though they gain back after you resuscitate them, but then they ended up dying a day or two later. Well, was it because of the brain swelling? And now they're brain dead. Okay. So that's the purpose of some of that hypothermia behavior, is to prevent that from happening. And more of those go home cognitively intact versus a vegetable. Okay. So that's the purpose of that type of a study. So thinking, it's kind of easy when they're in cardiac arrest. Somebody starts bagging, somebody does compressions, and you get ALS there, and then they play with all their toys. They're good teachable moments. You get to play, you get to intubate, you get to use your nasopharyngeals, you get to use all your toys, and you hope for the better outcome. Okay. But it's those tricky ones. My heart rate is fast, or my heart rate is too slow. If it's too slow, they buy themselves a pacemaker, and if they're really lucky, they get the full Cadillac version that comes with the defibrillator with it.
Mhm.
It's like, yeah, bring on that one. It does everything. Okay, so those type of things that are going to go with it. But it's common in rural areas. By the time you get there, and the call comes in, and you get there, and you have how long is most of your transports?
30 minutes.
30 minutes at least.
At least.
Yeah, and maybe it took you 20 minutes, it took you 5 minutes to get rolling or
That's
more.
on good roads.
Yeah, and then you got to get to where you're going because it's past John Brown's farm. And so you're looking at sometimes an hour out doing some of that. And when you're doing manual compressions and everything, and if CareFlight can't help you, then, what is their outcome? It's going to be low, isn't it? Yeah. Versus that person that was right across the street from the hospital. Make sense? But think about too, those ones that have that chest pressure, their heart rates are fast. So have them slow down. So what's a normal heart rate?
60 to 100.
60 to 100. Now, just because his heart rate's 120, are we going to worry too much? No, find out why. Could it be that he was sick and has a fever? Possibly just because you came and the ambulance came with lights and siren, could that raise it?
Mhm.
Yeah. Could that raise his blood pressure too? The old white
Or
coat
his wife
syndrome?
hollered in the background going, hi.
Yeah.
Whatever.
So some of that stuff, but keeping them calm, keeping them going there. Do we necessarily need red lights and siren heading to the hospital? Is it going to make a difference? No. Sometimes it will add to their anxiety. It's like, try to bear down, get some help coming. Because realism, just putting your lights and siren on, what does that do for your driver? Pedal to the metal, right? And should they be going more than 5 to 10 miles over the speed
What did
limit?
you gain from it?
Yeah, how much time do you gain? So, that was a thing when I came to Aberdeen as a paramedic. I was their first one here. And I don't know that the dispatcher, her name was Gladys, poor Gladys, I got her, she's gone now, she's an elderly lady, I believe, on the radio. But she would always, you know, the tone would go out, chest pain. Yeah, we're gonna go red lights and siren there because we don't know what we're gonna deal with. When I got there, and there would be times, you know, that I would choose not to go red lights and siren back, just simply because it was too much anxiety for the patient, and would it save me time and would it put us in danger? Okay. There would be times she would come across unknown medical or maybe having some difficulty breathing, but doing okay, request no lights and siren. Am I gonna go no lights and siren then the scene? Probably not, because do I know what I'm getting into? No. So she would yell at me all the time. And so then I said, Gladass, who's the paramedic? So we would have, I never met her personally, but she didn't like me, I'm sure. But you always want to think about your patient too, okay? Any questions?
What's the percentage of recovery from CPR?
You know, right now, actually, I know some of their slides were lower, but since Lucas came out and with the 2020 guidelines that came out and everything, they're saying that actual with AEDs out in the public and with Lucas's, you know, there's more people that are doing things faster.
Mm-hmm.
That we're almost at the 25% of our out of hospital
Increase?
survivability. Yes,
With Lucas
big time.
increase.
Well, with that, AEDs was the key factor.
Oh, yeah.
Yeah, AEDs is a key factor. Right there. I mean, look at your football player.
Mm-hmm.
I mean, they had the AED there immediately. They started compressions immediately. He's neurologically intact. Was at the Super Bowl.
Mm-hmm.
Okay. But he had what was called that core pulmonale. He got hit right in the heart. Now, we don't usually see that with football. So that was a rare occurrence. So he's a healthy athlete. Where you guys are going to see it probably more frequent, that core pulmonale, is in baseball and softball.
Mm-hmm.
When you're getting called out to the ball field, you get there and there's that big red spot right over their heart. That's what they have.
Mm.
You know, you got a healthy heart, you know, hopefully somebody got the AED there. And that's why AEDs were placed in schools and they're placed in areas where there's large group gatherings, events. You know, you've got your ball games, you got more people there at those type of, it's not that really that the kiddos go down, but that's where grandma and grandpa will be.
Yeah.
Well, more and more churches are trying to get it or are
Yes.
getting it because that's where there's a lot of
There's a lot of
weddings and such
gatherings.
and stuff too.
And you got more elderly there. But you're right, they're out and about. The more AEDs are out there, that's what's saving the lives and that's what's increasing your survival rates.
The question with Lucas, when you apply it, you push down on the chest, take it off. You start it up. It goes down so far. You got a 250-pound person. I can live that. Oh, you got this 9-year-old female with a chest like that.
You might
What's
want
going to
to,
happen?
you're gonna break ribs.
I'm telling you, yeah.
Even if you're doing good compressions on an elderly person, you're gonna break ribs.
Mm-hmm.
I know the first autopsy I went on, did CPR and care flight. I followed that person all the way to the morgue. Did an autopsy on that person. It was a younger person.
There's no control on the
I'm like,
Lucas.
wow, look at all the ribs.
There's no control on the depth of a Lucas as it just was.
Yeah. It is what it is. And so sometimes you have to think too, you know, you follow the manufacturing guidelines, but you know, if that's a frail little 90-year-old, do I want to put Lucas on?
That's
that
right.
person? I might want to do manual.
Mhm.
But you are going to break some ribs. And sometimes that's the only way you're going to get down where you need to be in doing that cardiac.
It's an awful sound.
It is, and it's a weird feeling under your hands. So you just have to, you know, you do what you can because they're dead.
Mm-hmm.
But can you prevent them from being dead?
You know,
Maybe. And if they complain because they have a few broken ribs,
That's
that's
right.
okay too. Because you know what? They have the ability to complain.
I'd rather have a broken bone than be gone.
Right. Sometimes, yeah. So you have to weigh the outcomes.
Yeah.
With it. So you do the best you can, and you can only do so much too, because once you tire, your crew tires, are you affected?
Mhm.
No, and that's where Lucas came into play, especially for rural South Dakota.
Mhm.
That's huge. And it's an extra partner, especially when you're running short. You got now 3 people in the back of that truck,
Mhm.
and you don't even have to take him out for lunch afterwards. Okay, what about your AED? So do you automatically place the AED on anybody that's unresponsive? If you put the pads on?
Yes, is what's coming through the chat.
Yeah, I would put it on. Is it gonna hurt anything? It costs you some pads. But do I know why they're unresponsive? No, what if it is a diabetic emergency? Do I still even know what their heart rates are doing per se? I mean, I can take a pulse and see where they're at. And again, if it's a young person and they're with normal limits, I probably wouldn't do it. But oftentimes, you can put it on anytime. I know even on CareFlight, I mean, that was our pads were our heart monitor. So everybody got them. And all we had to do was switch it over to AED mode if we needed to shock. Otherwise, we knew what our heart rate was. Didn't hurt nothing. They still had the pads on. If we needed to pace them, we could. Still had the pads on. And we charged them. But you have them there precautionary. So nobody got in the helicopter without AED pads on.
Oh, really?
Pretty much. Most everybody had them because
Mhm.
crap happens.
Mhm.
It's kind of like when you come into the ambulance bay. When I worked ER and things as a nurse, and you guys would come rolling in, you got the IV started, and you come in and say, we got the IV, it's a 18 gauge, or maybe you even put a 14 gauge in there and you got some fluids running, right? Because you had a trauma patient. And then I go to check it's like, got infiltration. Whatever it is in an ambulance bay, as soon as you move that patient out of that truck, it's like a vacuum. It sucks the life out of everything. They might have had a pulse when they're in the back of your truck now, and you walk through to the ER, they lost it, right?
Mhm.
Moved it over, the IV's no good, they intubated them, that's no good. So it's like everything gets sucked out in the ambulance bay. Or anytime you move them. So just being alert, believe that it was there, yes. But things happen. So always reassess. So how do you know if this guy's unresponsive? Is it cardiac or is it related to a drug overdose? How do you tell the difference? Besides looking around.
Pupils.
Pupils, you can look at his pupils. What am I looking for?
Pinpoint.
These are pretty dilated.
Mhm.
Yeah, could they be pinpoint, which would be a narcotic oftentimes?
Yeah.
And if anybody's there at the scene, any family, any friends, try to gather information to find out potentially if he has a history of cardiac or has a history of diabetic or
And most of them they say what? I don't know.
sometimes not. Sometimes they're very
Sometimes they're very concerned and they're honest.
Mhm.
They are. So then with the Narcan, when you give the Narcan, what do you expect?
sometimes they come out very agitated, very upset, very
Yeah, you just brought them down from their high.
but they don't realize what they're doing or what's going on. They're just in a
You wanna fight?
So how do you calm them? What do you do?
try to keep them on the cot.
Yeah. Does it last real long? It can vary.
Yeah.
Yeah, a lot of times they'll go right back down.
Mhm.
Like, okay, go 99 again. We know what it is. But we'll watch you and make sure you're breathing okay. Okay. And sometimes it's just that way of checking it out. Okay. So just being alert to them. How do you stimulate them when you walk in to see if they're just sleeping or not? Yeah. Yelling at them, sternal rub, the old nookie,
Mhm.
that hurts. Taking your pen, roll it across their cuticle here, that hurts like a dickens.
Mhm.
pressing a pen right there, that will hurt.
Did that in my feet, I'd go through the roof because I hate people touching my feet.
There you go. But yeah, sometimes I just take my pen and just press it against her cuticle, because that hurts, and you never want to leave marks, so it doesn't.
I think they're switching.
All right, you learned something.